Hey guys, welcome back to today's video. We will be discussing a patient who had a left-sided parotid swelling. He's had a slow-growing mass here for a while, and we'll go ahead and remove it, supervised by the Dr. Wahid. This patient, as you can see, has a left-sided mass in the left side of the face, kind of extending into the parotid region. So we have to approach the area as a normal parotid surgery. Here we are injecting local and making the incision across a partial lazy S, not completing the whole S, to kind of go along and explore and see how much space we need in these types of surgeries. We like to begin very carefully using the same procedure as a superficial parotidectomy. So going over here and using cautery and a right angle. This is the site of the greater auricular nerve, so we're going to go ahead and try to preserve this nerve. The patient, we're working in layers, exploring the muscle. This patient had a slow-growing mass for many years, causing a facial deformity. And here we are working, again, very meticulously around the sites of nerves and large vessels, using ligature when we need, using cautery for small vessels, and always avoiding it around vessels and suspected branches of the facial nerve. So we begin dissecting away the major structures and then kind of using an extension to the skin to see more of the area. As you can see, the mass is like visible as it's abutting the parotid gland on the left side. We begin making space for ourselves to work, and then begin delivering this mass. By ultrasound, this mass was either a lipoma or a lymphangioma, and we will be trying to be reaching the source. As you can see, it's a pedunculated mass, and we're working more superiorly. But also working more superiorly is more dangerous because we are getting to the area of the nerve, the facial nerve. The facial nerve comes out from this area, so we have to be careful around it, working very meticulously to find all borders of the mass, hopefully leaving nothing behind. And here we are meticulously dissecting away the mass and also creating a more incision to the skin to extend the flap, making a more incision to the skin to extend the flap. That way all of our borders and margins are safe. Being at the site of the facial nerve is also very dangerous. We have to work ligature. We can only work with a ligature device when we know it's safe. And here we are exploring the deeper parts of the nerve. Where the trunk comes into the site of the face. And the mass itself is expansile, so it's also difficult to work around it. And having to work into the origins of the mass and trying to remove the origins to prevent recurrence. These types of masses usually will have to ligate the vessels around it, lymphatic structures around it, and make sure that there is no connection to the underlying parotid. In this case, we see a structure that resembles part of the branches of the facial nerve. So we're taking our time, kind of going along the course of the nerve and seeing if there's anything that we can sacrifice or anything that we can remove. At the end of the mass, it looks like it's coming from beneath the nerve. So we're making sure to kind of bluntly dissect it and pull away at it. And as you can see, the source of the mass is coming from deep within the parotid space. Here is the full size of the mass, roughly 11-12 centimeters. And then we will begin hemostasis in this area, putting a corrugated drain, an open drain in the site of the parotid as usual, and then begin closure for the best cosmetic outcome. This patient was abroad and he asked for this procedure to be done for him. And he also asked for the video of this surgery. It's a very interesting case, and by histopathology was a lymphangioma, large and slow growing in size, kind of affecting his daily routine of his face and his look. So cosmetically, he was very happy with the result. We were also very happy as a team, and we closed this in a subcuticular fashion all the way to the end. And we appreciate you watching this video, and stay tuned for our next video. We have multiple surgeries in the future that we will discuss. Thank you, and see you next time.